McArthur. Grant, thank you so much for joining me this afternoon.
Thanks for having me.
First, take us through the overall health segment as part of Future Victoria. What are the key focus areas?
There's any number of machines that go ping in hospitals, and they're getting better every day. Any number of medications that are keeping us alive for longer than ever. But I guess the future of health divides into two ways. There's the future of the hospital system, then there's the future of the health system. And they can actually be quite different, because the real future in getting the health system right is probably outside of the hospital, and it's ways to keep people out of the hospital.
Everybody. Type of ways rather than letting it get to the acute system. There's things such as technology that you can use in the home, even on a smartphone, where you can almost have your own GP appointment now that are being trialled overseas. There's telehealth that's being radically upscaled across the world that isn't quite getting to that point in Australia where we need it to be, but digital health records will help that. Build a huge foundation that the hospitals can use to then spread their services out into the community, so we're not having so many people in what are very expensive hospital beds to run.
You've taken us through some of the technology that is needed. Are there any challenges here? Any challenges to achieve this?
Obviously, getting digital health records is absolutely fundamental, and getting digital health records that are secure and that people are comfortable using and signing up for. Then there's also having, 4G networks, NBN across everywhere, so we can have equal health. If you can't have those services, then you can't have people connected to them. It's all very well to live in metropolitan Melbourne and be able to go to your hospital. If you're living in outskirts of Mildura and you want to see an oncologist, that's not so easy. You do need very good digital networks to be able to do that. You need to be able to send MRIs, scans, all of those sort of things. They're huge data files. It's not the sexiest part of health, but it's absolutely fundamental in getting an equal system across the board.
Take us through the program used by Western Health.
Yeah, absolutely fantastic program, and there's a couple of others sitting out there. And in this, it comes down to the sickest 5% of the population actually account for 80% of the health budget, and it's huge numbers. This program is aimed at targeting a lot of those people that are the frequent flyers in hospitals, that are almost visiting hospital on a weekly or a monthly basis and using up a lot of resources. Rather than letting them get to that acute situation where they're requiring so many resources, they have a computer algorithm that picks out the patients that are coming in a lot, that have got complex, 2, 3, 4 different conditions that need help. That raises a red flag on who they are. Then they assign a case manager to them, and that opens up a lot of other services where they have home visits with nurses, they have regular appointments with GPs. So all of their health needs are actually addressed proactively before they spiral out of control and become really sick. And we're talking about patients that might be with very serious cardiac issues that might end up in a heart transplant down the track. Those are actually being avoided because these people are being monitored so closely that they don't quite get that sick, and their conditions are treated otherwise. And it's been so successful over the past 2 years. It's something like 9,500 bed days that have been saved that these people normally would have used up. It's the equivalent of funding an extra 14 beds in just that one hospital per day. So there's 14 extra beds in the hospital because they're not being used for these people, which in turn means other patients that are sick can come in. It also has saved $14 million in 2 years. Now, if you multiply that over the health system, that is a huge way of freeing up resources, a huge way of freeing up funds, and just as importantly, it means that these people aren't actually getting that sick that they have to be in hospitals. They're having a better life.
Another aspect of this was also looking at diet factors, and I noticed that Vic Health's Chief Executive Officer said that rebalancing the state's diet really was the key ingredient in reversing a tide of chronic disease. Can you take us through it?
Absolutely. This comes in at the other end of the health system. On at one end with the Western Health Program and a few others, they're trying to keep the sickest people out of hospital. This comes in at the extreme other end. This is before people get sick. This is about ensuring that people don't ever develop these chronic diseases. And it mightn't sound like the newest thing to eat fruit and vegetables, but it is fundamentally one of the most important things we can do to turn it around. Currently, only half of Australians actually eat the recommended daily intake of fruit. Only 1 in 13 eat enough vegetables a day, which is 5 to 6 serves, incidentally. If you can increase the rates of that, you increase people's health issues.
You don't have these problems. The biggest problem is access to fruit and vegetables. We live in a country with so many wonderful farms, and we're renowned around the world for our farming, yet people in country areas actually have worse access to fresh fruit and vegetables than just about anybody. You're more likely, if you get off the train in a country city, even in a Melbourne suburb, you're going to walk past 10 or 12 fast food restaurants and billboards before you go past a single supermarket or a greengrocer. And some of these access issues are as simple as redesigning streets, so you've got more access to go past these places. It might come down to price points in supermarkets. It doesn't even need to be that complicated. It can just be education in schools, teaching kids the value of nutrition. Those messages come back to home. Ways to help time-poor parents make better food.
Certainly a lot of aspects to it, and to read more about the Future Victoria special investigation, pick up a copy of today's Herald Sun or head to heraldsun.com.au/futurevic. Herald Sun medical editor Grant McArthur, thank you so much for joining me this afternoon.
Thank you.
To the rest of the day's news now, and a rise in gang violence in New Zealand is being blamed on criminals who've been deported from Australia. That's according to the head of New Zealand's police union, who says the changing gang scene is why proposed new gun laws are essential.
Mustafa Farouk has led New Zealand's Muslim community through the toughest of times this year. As a consequence of one of the country's darkest days, he has a simple and heartfelt message to opponents of a second round of gun law reforms.
The right to life supersedes any other kind of rights. And if we can tighten the gun laws in New Zealand to make sure what happened in Christchurch never happen again, I think it is worth people giving up a little bit of that right that they want to keep.
At Parliament this week, multiple groups representing firearms owners submitted to MPs why a bill to strengthen the country's gun laws is not fair.
We've been made to feel like we're on the wrong side of the law, that we aren't to be trusted and that we're criminals. We are fit and proper people.
Gwyn Thurlow claims the proposal discriminates against licensed firearms owners.
To put further restrictions and take rights away from these people is just unbelievable.
Changes include tighter rules for owners and dealers and a gun register.
This idealism is not practical or possible to implement, and as has been demonstrated